be case manager, which has been a huge and wonderful addition to our program. Okay. So just to set up some framework for everybody about the way that we think about housing, housing is a human right. This was determined by the UN Declaration of Human Rights many years ago. People all over the world have the right to have safe, secure housing. We also know that housing is medicine. Housing keeps people alive, it helps keep people healthy, and is vital to ensuring that people can focus on their health. But that's not the reality that we live in, right? We all know that. We all live in the Bay Area. We all pay Bay Area rents or mortgages. Affordable housing here is scarce to non-existent. Those of you who work in housing know that, you live that, that's your work. That's what you do every day. At Trust Clinic, we see folks who are experiencing homelessness because they get SSI and they can't afford to live anywhere, or they have no income. In Alameda County, there's an estimated shortage of 60,000 units. And the last estimate of people experiencing homelessness in Alameda County was over 8,000 people. That was in 2019. There's a new upcoming point and count survey that's going to happen in January. Half of those 8,000 people were in Oakland, where we work and we see people. So there's clearly a huge need for investment in permanent supportive housing. People talk a lot about different interventions to fix the homelessness crisis. All politicians have all these ideas. You all know that permanent supportive housing is what cures homelessness. The problem is that it's very expensive. So Nova Apartments is one example of a new permanent supportive housing project in Oakland that was very successful and beautiful. So in this context for this workshop, we're talking about people living with HIV. They are even more impacted by the housing crisis because 5% of people experiencing homelessness have HIV, are living with HIV compared to 0.4% of the general population. So more people who are homeless have HIV than the regular housed population of Alameda County. In addition, being homeless when you're diagnosed increases your risk of death by 27 times. Just think about it, 27 times compared to people who are housed at their HIV diagnosis. And we know that that's because of all of the other things that go along with being homeless. Living on the streets, living outside takes a huge toll on people that Tori and I see every day. And homelessness is a major challenge to ending the epidemic of HIV because of all of these things. When folks experience homelessness, it's very hard for them to take their medicine every day. Their backpack gets stolen, they have other competing needs, they don't remember, they can't get to the pharmacy, they lose their ID. That means that their viral load isn't suppressed. We know that if your viral load is unsuppressed, you can transmit HIV. People are exchanging sex for money, drugs, and housing. They're trying to meet their basic needs. And all of this makes it very hard to keep folks in care. It's very challenging to make doctor's appointments when you don't have transportation or you have to leave your tent unattended. All of your belongings makes it very, very challenging for folks. And it's a risk factor for dying. We see the mortality level of our clinic is so far above other clinics, even at Lifelong, even other FQHCs. And all of this is a huge problem. We're not going to be able to end the epidemic until we figure out how to help people get inside. So we've also seen when we get people housing, when people get inside, they can focus on their health. Their viral load suppression improves. They're able to take their medication because it's in the same place and no one's going to steal it. They're able to engage in care because they have a reliable phone. They remember their appointment. We can get in touch with them. And all of this improves, the rates of HIV transmission. They're less likely to transmit HIV to somebody else, and they're less likely to die, which is ultimately our goal. But it's really hard work. It's historically very difficult to keep folks who are experiencing homelessness in care for a lot of different reasons. A lot of our patients experience issues with substance use, mental illness. They're very distrustful of the medical system. They've been mistreated and marginalized. And then on a structural level, there's all kinds of racism, homophobia, classism that works against folks getting into care. At Trust Clinic, those are the kinds of things that we work very intentionally on trying to improve. We also know from research done in San Francisco that what patients want is a strong relationship with their provider and clinic, and they want drop-in care. Because their lives are so hectic, it's much easier for them to just show up and say, hey, I'm here, I need X, Y, or Z thing, and for us to be able to try to provide that. The care that they need, that folks experiencing homelessness need, looks very different, and their needs are very different than what housed people need. And that is even more true when you're talking about folks living with HIV who have a lot of other different needs, and their care is just more complex. Those are just some references if you're interested. So now I'm going to have Tori talk about a couple of our cases of real patients and what their housing journeys looked like.
Thanks, Maggie. That was awesome. And Sophie added these, so these are all shared with you, so you can take a look back at the presentation if needed. So our first case that we wanted to share was, it kind of shows some of the community resources that were used during the pandemic. So the first one being Operation Safer Ground, which are in the shelter in place hotels over by Hagenberger, and using the PSH target list. So this specific patient, he became homeless after concerns that his neighbors were harassing him, entering his unit, threatening him with violence. And so, ultimately he left his housing because he couldn't handle it. He was connected with lifelong supportive housing for a while, since 2012, but once the clinic opened, he connected with us in 2019. At that time, of course, trying to help him with getting referrals over to shelters, community cabins, but he declined everything and preferred sleeping out on the street just because he didn't want to live around people. So when Operation Safer Ground opened, the clinic ran a list for eligible patients, and he showed up due to his HIV status and his mental health status and all the other chronic diagnoses that he had. And so he was outreached by our health and wellness coach, which was me at the time. And he said that he was interested and that, it's a place that he could go, he could get housing support. Like, it just seemed like really great. So he wanted to be referred. So we referred him. We referred him in August of 2020. He was accepted a couple of days later, and we got him there August of 17th, 2020. So he was connected with a housing navigator at Operation Safer Ground, and he was able to complete the CES or update it because he was already in the system looking for housing. So he was able to update his CES and work with the housing navigator, get document ready. And for those, I know that Judy and Angela are probably going to go over this, but being document ready means you have your ID, Social Security, income verification, and disability, because those are the things that you need to be housed. And so he was matched to a housing opportunity in Newark, and he was really excited about that because he kind of wanted to get out of Oakland, try something else out. So he accepted and he moved in, and he's still housed. He's been housed for a few months. And then for our next,
CES is the coordinated entry system. Do you want to just say a sentence about that, Tori?
Yeah. So the coordinated entry system, um, it's an assessment that housing navigators or that the system uses, and it asks questions about housing status, how long you've been homeless, your medical diagnoses, and it places you, depending on your score for the CES, it places you on a list of people who need housing. And that list changes all the time. People move down, people move up, depending on what their situation is. And it's to house those who are, more vulnerable out in the street.
Right. So revisiting his CES entry was important because if it doesn't say HIV or doesn't have his age or other comorbid medical conditions, he's not going to get ranked appropriately. The other thing, just Operation Safer Ground, just for those of you who may not be aware, was Alameda County's effort to house people in hotel rooms during the pandemic to prevent the spread of COVID. So it was for vulnerable patients with specific medical conditions or age based. Sorry, I just want to make sure for folks who weren't sure about that stuff.
Definitely. And then if right now there's like 2 hotels, one of them is called Oak Days. And I know a lot of people know that as Oak Days now. But it's ran by Five Keys too. So if we have any Five Keys people here who want to help us out in the breakout rooms later, that'd be great.
Shout out to the Five Keys people. Thank you for all of your work during the pandemic. If you're here.
All right, and then the next case, it talks about HOPWA units. This previous case, something to note about him is that he is not currently in a HOPWA unit. This is just a match he received and was able to get in. So he is not currently in a HOPWA unit. But this next case, this patient is, so he was homeless at Mosswood Park in Oakland for many years. He had a partner and he had, his HIV diagnosis and he was off medication. He was hospitalized for respiratory issues and then discharged to a skilled nursing facility. And so, something to note is, this guy was at the park, he was homeless, didn't have his medication, and he was hospitalized. He was able to connect to medical care because the hospital put him into a respite. Respite, if you guys aren't familiar, it's a place where people can, recuperate, have nurses on site, help with medication adherence, just get healthy. And it's a really great opportunity for people who are on the street who just had major surgery and can't take a bath out on the street. And so this is a way that they can heal without having all those other stressors that they would have on the street. So he was referred to respite, but he declined because he didn't want to be away from his partner. And so what he did, we connected him to the trust case management and we applied when Camino 23, which is a housing building that has HOPWA units. When they opened, trust was able to, gather some patients and help apply. And so this specific patient got the interview, was accepted and moved in, and he was able to bring his partner along. And in this bullet point, the patient has a lot of other friends who are homeless, and it's nice that he's offered them stability using the resources that he got. So he was connected to care. He's taking his HIV meds more regularly, all of his other medication, and significantly reduced his substance use, all because he was housed, and he's still currently housed. You want to add anything else, Maggie?
Yeah, he's a great example of the community of the communities that sometimes development in encampments. These folks, the three of them had lived in Mosswood Park together for years. And so he was very hesitant to live away from them or accept any housing apart from his partner and their friend. So it was actually really wonderful when they got a unit and were able to live inside. And he's done much, much better. His respiratory issues are improved and he's been able to focus on his health a lot more, which is great.
Great. Thank you so much, Maggie and Tori. Really appreciate you sharing those cases. So we're gonna move to Angela Moore, who will share a case from Contra Costa County. So you see, you can get a sense of what it's like to do housing advocacy in Contra Costa. So Angela, are you great?
Can you hear me? I'm not going to turn my camera on. So can you guys hear me?
Yes, right now it sounds great. Thanks.
Okay. So I'm going to start with my client, Mr. G. Mr. G was a homeless man living in Contra Costa County, actually central Contra Costa County. He also was living in his car with no hopes or faith that he would be able to find housing, especially the COVID pandemic. He really just kind of wanted to stay in his car. He didn't want to go in any of these shelters or anything like that. It was suggested to Mr. G that he would contact 211 to see if he could be linked to core services where they would take an intake and complete housing searches on that end, and I would still keep doing housing searches on my end. He was very doubtful in the process because one, he never heard of it, and resources and things like that available. And he wasn't sure of the process. So I had to explain it to him again and again, the process, and to at least please think about it and give it a chance. Well, he took me up on it. He gave it a chance. He contacted 211. He was linked with the core team in Contra Costa County, where they placed him in a hotel. They had various hotels, Pittsburgh and Richmond, but he got into Central County in a hotel there. While waiting, the Martinez Housing Authority was giving out housing vouchers to those who were 55 and older and who had a disability. And he was one that got a voucher. He got housed in West County. He had successfully housed in West County, and he said to me that his nightmare came to an end and he is successfully housed and he's happy. But he was one that had given up on the process because they have, some of them hear real bad things. Oh, it will take forever. I can't get a voucher. He was blessed to get a voucher when the vouchers were being handed out. He was in the right place at the right time.
Yes, and thanks to you, he was ready too. So I think that's one of our takeaways that we've seen is that, what Tori and Maggie had said about being document ready, that's super important, and oftentimes is the rate limiting step. I don't know if you all have a lot more experience with this, but I think, as much as we can help clients be ready for when those moments like you describe, Angela, come up, when the vouchers suddenly become available. Or Cassandra, I know you wrote in chat, like there's some 5 housing units available at Saha today, we have to just be ready to jump on that. And it's hard to always be ready, but as much as we can help clients be so, it really does help. So that is a major role that I think we can all play with that. So thank you for sharing that, Angela.
You're welcome. It's just the fear of the unknown.
Yes, and that is another role that I think we play too, is providing that reassurance and to reduce some of that fear. So thank you also for lifting that up. Great, thank you, Angela, and we could hear you great, so thank you. And Judy Eliashar from AIDS Housing Information Project in Alameda County, I'd like to invite you also as a housing group co-facilitator to share your story and also some of the handouts that Judy provided for us. Judy, you're muted. If you can unmute, I think that'll help.
It might. Okay, so first unmute, and then Tori and Angela, thank you so much for the success stories. There's a lot of work and complexity that goes into opening a door for somebody and helping them to become housed. And those are the moments we really live for. That's what makes this work really worthwhile. What I'd like to do though, is I kind of like to shift the focus a little bit and take you behind the scenes of a successful collaborative process that resulted in 5 unsheltered people living with HIV moving into permanent supportive housing. The handout describes the collaboration in detail, but I just like to set the stage a little bit. The events that I'm going to describe also took place last spring, a few weeks after the shelter-in-place orders took effect. The Project Room Key Safer Ground hotels were just opening up. And I know you probably remember the general sense of urgency about what we could do to protect the vulnerable members of our community. So from beginning to end, the work that we did probably took about 6 months. The housing units that were available were single room occupancy or SRO units at the Harrison Hotel in Oakland. The building had recently undergone a major renovation. It's owned by Resources for Community Development. It's managed by the John Stewart Company, and there are on-site supportive services provided by Lifelong Medical Care. Just more details to show you how many players were involved. Funding is provided primarily by the Shelter Plus Care program, which is administered by the Alameda County Housing and Community Development Department and 2 local housing authorities, the counties and Oakland Housing Authority. Shelter Plus Care is probably the oldest HUD program serving unsheltered persons. And there was also funding for these SRO units that came from HAPA, the HUD program that funds housing for people living with HIV and AIDS. So locally, Homestretch, which is an agency within the county's coordinated entry system, was responsible for seeking applicants who met the Shelter Plus Care and HAPA criteria, working with the service providers to assure that application materials were completed properly, and then forwarding the completed applications to Shelter Plus Care. So at the beginning, to obtain referrals, Homestretch contacted a handful of agencies. AHIP and the Crossroads Shelter were among them. So AHIP and EOCP staff identified some residents at the Crossroads Shelter who met the eligibility criteria. We worked with them to prepare their applications and core housing documents. We also reached out to Ryan White medical case managers to identify clients that might qualify. Sort of by happenstance, we ended up working most closely with the medical case manager at Lifelong Medical Care's Ashby Health Center in Berkeley, and with the nurse case manager at AIDS Healthcare Foundation. So for a few months, we met regularly with applicants to explain the program and the requirements and to support them in obtaining income verifications, DMV IDs, duplicate social security cards, verifications of diagnosis, and obtaining those core housing documents, especially early on in the pandemic, was unbelievably challenging. DMV was closed, social security offices were closed, communicating with social security by phone it took excruciatingly long time for people to get their proofs of income. And behind us the whole time, there was this pressure of getting applications in quickly so that the person didn't miss the opportunity. And in addition to that, several of the people that we were working with had moved out to the Radisson Hotel Safer Ground site. And another agency I want to mention is Abode Services. Their staff was instrumental in granting us access to the site and arranging meetings at the hotel that complied with COVID requirements. So by summer, our work had entered a new phase. The completed applications had all been sent to Homestretch. Homestretch had forwarded them to Shelter Plus Care. Shelter Plus Care referred the applicants to the Harrison Hotel, where they were interviewed by property management staff. The approved applications were then sent by Shelter Plus Care to Oakland Housing Authority to be approved for the Shelter Plus Care and HAPA subsidies. So when necessary, we acted as a liaison, relaying information back and forth, responding to questions about missing forms that needed to be signed, getting appointments scheduled, briefing sessions scheduled, what was the rent and security deposit going to be, when were the move-in dates, just sort of keeping the confusion to a minimum. But by
Sorry, Judy, we're at time. I just wanted to let you know, but please wrap it up whenever you can.
Okay.
Thank you. Thank
I
you.
got okay. So by September, the 5 of the people that we had worked with had moved into the Harrison Hotel. They're paying 30% of their income for rent. They're participating in on-site support services. And then the last thing that we did was we worked together to submit Season of Sharing and Homestretch Fund applications on behalf of some of the new residents that covered their security deposit, first month's rent, some furniture and household items. Real quick, Cassandra from Lifelong Medical Center is here with me. She was my partner in crime throughout this whole process. Cassandra, it was great working with you. Couldn't have done it without you. She's an outstanding medical case manager. So housing resources, what we're giving you is sort of some information about the HOPWA program in general, a listing of the buildings that have HOPWA units in Alameda County and Contra Costa County. Keep in mind, 95% of them have closed waiting lists. So it looks really good when you see it all printed out, but it's in real life, HOPWA is a very tiny program. And then contact information about AIDS Housing Information Project, how to reach me, how to reach Angela at Hope Solutions, and some information about CES 211, et cetera. Sorry, I went over. Thank you.
No worries. Thank you, Judy, for sharing that. And it's a great illustration of how many people you need to get people housed. It really does take a village, a large one, in fact, a large city.
Oh, right, exactly.
Yeah. So really great to have that collaborative spirit and also just work on all the technical details of filling out forms and having documents and all that stuff. So thank you for doing that. And thank you, Cassandra, also for being part of that collaboration. And I'm sure there's other folks here too who have been part of collaborations just like this. So without further ado, let's go into our breakout groups. And Yamini, if you have the questions to put into the chat, basically they're pretty simple. We're gonna be in groups where we're trying to mix at least one housing person with HIV folks. Mostly we're HIV folks here, but we'll try to mix it up a little bit, and then we'll share introductions again. Then we wanna know what your burning questions are. Like, what do you really wanna talk about during our 20 minutes or so together? And what can we share with each other? So then we'll have a small group discussion and then come back to the large group and share highlights. So Jessica is going to help us now go into our breakout groups. Thank you all. And thank you, Maggie, Tori, Angela, and Judy for sharing those great stories and your wise experience getting folks housed. And I think Shirley also shared in chat how difficult it can be after somebody's housed to keep them, say, stable. It's a new environment for them with different people. Substances may play a different role in different ways. And so it really requires a lot of ongoing support. So really grateful for all of you for also providing that ongoing support as well.
All right, I think we're all set. I'm opening the rooms.
So we are going to do a quick report back and would love for our small group facilitators to share highlights. So one or two highlights from what was useful, a useful strategy from your small group. Can everybody see this okay? Okay, so I'm going to just take notes. Tori, highlight from your group.
Yeah, so we talked about a lot of good things. One of the biggest challenges that we talked about was COVID, and especially during the beginning of the pandemic, how you had to learn how to case manage differently and in different ways. But something that we discussed was common with your burning question is just where are those resources? Is there this one document that has all of the resources? And, we don't really know if that exists because different organizations have access to different resources. And just kind of where to start when, someone's new and they have never done this work, where do we start? So I thought that was a lot of good work and just, resources are so big.
So did you come up with where you start? What's your one thing to get started with?
Oh, we actually weren't really able to, figure it out. We had 3 case managers and a program manager, and it was, we just kind of talked about challenges and, the biggest thing is definitely document readiness. But we also talked about challenges with being document ready, challenges with getting IDs and social security. And so we definitely had a lot of discussion about the challenges. But yeah.
Great, thank you. I think hopefully some of the strategies will also be shared in some of the other groups as well. Maggie, do you want to share a highlight from your group?
Sure. We talked about how it can be frustrating when other providers seem to have access to housing resources that you're unfamiliar with, and wanting to learn more about how community cabins work, and 211 and Operation Safer Ground. So those were some of the things that folks wanted to learn a little bit more about, and sharing sort of the resources of what we all have access to and what we do. So Rebecca shared about her work at EBRCP, and then I talked about my experience with Operation Safer Ground and the community cabins, and hoping to get some of that information out there. Our starting point is often the CES assessment.
Great, thanks, Maggie. Angela?
Yes, guys, since you can't see my face, I'll do it this way that hopefully you can hear me. So in our group, it was Kelly Resch and Imani and Watkins. And if I said your first name wrong, I apologize. So we talked about needed services for the different clients in both Contra Costa and Alameda County. And we talked about funding, emergency funding, low income affordable housing, as well as HOPWA units. But the main thing that was brought up by Ms. Watkins was mental health. So through the pandemic, people's mental, they went through serious issues with their mental health, being able to find a mental health provider. We talked about how this needs to start at the state level, and that's as far as the housing piece, and and developers who want to build. But the main thing was mental health. I shared where people would get a mental health person going through that access line, finally get someone, and only for that person to be an intern. And when their internship was over, they left. And so they were getting frustrated. Clients were getting frustrated that they get involved with someone and then they go and then they have to start all over and share their story. That's frustrating. And the lack of mental health providers in West Contra Costa County.
Yes, thank you, Angela.
You're welcome.
Great, and Judy?
Well, we went off in a slightly different direction. One of the questions that came out of our conversation was how we can work locally to develop new small-scale affordable housing that's innovative and that's locally controlled. We talked a lot about the big political systems that are and economic systems that are at play and that have control over where affordable housing is and who gets it. So that was one question that came up, was what can we do locally to increase the supply of housing that would be suitable, affordable to people who are currently unhoused and who are living with HIV. And then the other thing that we talked about was training. Darren and Martin are both new employees of AHS and Lifelong. And so the question came up about the content and the timing of training around housing issues, housing resource information, et cetera, and like how that would dovetail with the more medically focused training that new clinic employees received. And Darren brought up a great point about getting to, quote unquote, the root of the problem in terms of like housing and healthcare and how they're intertwined. And that's it.
Great, thanks, Judy. Okay, I'm going to move to Sean.
Yes, so our group I had a mixed group. I had folks with no experience there to learn, and then folks that have been in housing for quite some time. And so what we spent our time talking about was basically the challenges, that it's difficult, there's not enough housing, housing is too expensive, and that part. But then our solution was the one solution that we came to was like there really needs to be more of a collective and collaborative effort on policy advocacy issues to really, because this is a policy issue. We know that there's enough money to house poor people in this city, in this area. I'm talking about San Francisco and East Bay, and that maybe looking at going about it that way as a strategy. Folks didn't have any questions because they've been doing this work for a while. They use similar resources as everybody else, but really the standout for me was that it's a policy issue, and how can we work on that and in that area to address some of these issues.
Great, thanks, Sean. And actually, for those of you who want to work on policy and advocacy, please join our housing working group that is co-facilitated by Judy and Angela, because that is one of the big priorities that they want to work on as well. So collective advocacy and policy change and increasing housing supply, because we know that we can actually do it if we put money and effort into it. Okay, Sammy.
Yeah, so our group really honed in on document readiness and that process. And our question was kind of how do we better support folks with document readiness, and how to really take the onus off of clients and put more of it onto the systems to do better for us. So I think most specifically, we talked about how the CES team is trying to get a standardized process for the documents that should be requested from agencies and from property managers, and how we can really have a checklist that's ready to go for case managers to use to facilitate the process, and then being able to use like the HMIS clarity system more effectively to store documents electronically, so that when that housing opportunity comes up, instead of starting from scratch, it's maybe just little updates to documents that need to be made. We also talked about how a lot of case managers have already been doing this really effectively, but how can we standardize this among case managers so this is something they take on early to help people prepare, and how important just attitude is of our frontline workers around this process, that helping people understand, yes, it's a process, but it's doable and we're here for you, and that we can't make promises about what can be delivered, but we really want to meet your housing needs and stick with you for the whole process. And that really changes client attitudes too.
Great, thanks, attitudes. Okay, thank you, that's great. This is some like good systems improvements too. So we're seeing like big level stuff around policy advocacy, and also more technical stuff around like how do we leverage the HMIS, electronic systems and get standardized document lists and all that stuff. So thank you for that. Yamini.
Hi, everyone. Shout out to Shirley, Cassandra, and Michelle for a riveting conversation. One of the things, and they could probably do a better job of reporting back, but a main concern folks shared is the idea of retaining people in housing, going beyond connecting or linking people to housing, and what does it mean to retain folks. Ms. Shirley shared 3 people were moved into permanent housing from the hotels, and she took 2 weeks off and came back to find folks were getting ready to get kicked out. There needs to be strategies around making plans for how rent comes out first. For that, there was shared what is the possibility of an optional payee program for folks. And I believe in San Francisco that is being enacted. There was an idea around a once-a-month housing application party where portable showers are brought, vaccinations are given, and other opportunities are shared, so that mostly in an effort to really streamline how housing applications work and how connection or linkage to housing works. And then another area that became important to discuss is how reentry in housing works. And so Michelle, who works at Santa Rita, shared that it's not super clear what paperwork people should be leaving with. And that's of course like discharge paperwork, but also like what do they need as far as ID, social security number, and then of course like meds, psych assessments, etc. So that clarity would be helpful. And that's it.
Great, thanks. So lots of great stuff for us to work on. Our group really also talked about, Tori, what your group mentioned. How do we get started? So you have somebody in front of you who is not housed right now, is in the street or in a car, is actively using substances, does not have any income, maybe undocumented. What do you do first, right? And so we had Marlene, Jamie, and Molly in our group and had some really great suggestions to actually get them stabilized through shelter or detox. Buy yourself a little time and have them like stabilized in some kind of shelter or detox program. And then call on your troops, get them, support them to look at more substance use services through their insurance or whatever insurance they have, but also call 211. So call 211 with them. See what you can get through coordinated entry through 211. And then if you need extra help, to call Angela in Contra Costa, or Judy or Angelica in Alameda County for extra help. So just really getting started through that process. And then you get into the zone of document ready. So some of the stuff that you all talked about. All right, so thank you for sharing all of that. We will try to summarize all the strategies that you've put into the chat, and also just now the highlights from your small breakout groups. This will be basically, this is all sent out to you in your handouts. The contact information is linked in your agenda, and then also in the first page of the housing packet. I think that might be page like 4 or something. And then finally, I just want to share a quick poll. I know we're over time. If you have a minute to stick with us, if you can share with us what you prefer for us to cover in our next workshop, which will be in the spring, March or April 2022. These are based on things that have come up in previous workshops. So if you can choose what you think we should cover next, that would be really helpful. So if you can choose your top topic for the next workshop. One option is overdose prevention, safety plans, and more substance use skills. Second is burnout prevention and management beyond self-care, and that's for us as staff, healthcare staff. Third is supporting people with depression and anxiety, so the mental health issues that some of you have talked about. Number 4 is migrant and refugee medical legal collaborations, and we did talk about housing undocumented people today a little bit. The 6th one is cross-county linkages, San Francisco, Solano, Santa Clara, and other counties, and then something else. And if you have something else, please type it into chat. So I'm going to give you a minute to respond to that. And then just want to share with you also, if somebody can put into the chat the evaluation link. Yes, thank you, Yamini, for doing that. We are going to be posting our handouts on a resource page and a video from today as well. And then please join us. Our next big community event will be for the World AIDS Day commemoration on December 3rd. So Jessica, do you want to share the results of the poll with folks? Oh my gosh, it's very even. Well, I guess the topics were all very interesting to folks. We'll have to think about this. We've got a tie between overdose prevention and cross-county linkages, and then a 3-way tie between burnout prevention, supporting people with depression, anxiety, and migrant refugee medical legal collaborations. So we will take that into account, and maybe we'll just figure it out based on what speakers and presenters we can get as well. So thank you so much for joining us today. Really appreciate you sticking with us and sharing your experience around getting folks housed and the challenges and also the strategies and solutions. And we'll try to sum up all the great stuff that you have shared with us today and share that out as on the webpage that we shared. So thank you for joining us and sticking with us.